Back now on Triad Today. Always glad when this lady can stop by and pay us a visit. She's very, very busy, and we're glad that she's here with us. Lori Bates, our director, and meet the lovely Robin Remsburg. She's Dean of the School of Nursing at Uncg and a fellow in the American Academy of Nursing, and wears many, many hats beyond that, but it would take up the whole 5 or 6 minutes to list all the accomplishments, but we welcome you. How you doing?
Oh, I'm great. I'm glad to be here doing my favorite thing, talking about nursing.
Oh, yeah, and especially UNCG, which we have in common.
We do.
Because I graduated from there 100 years ago. You ought to hang a picture of me up in the School of Nursing, you know, as how decrepit I've become, and they can maybe cure me of that. How has the nursing profession changed in the past 5 or 10 years, Robin?
Well, we've had to respond to the changes in the health system. I know you know a lot about the Affordable Care Act and many of the changes that have come along with that. The focus on quality of care and outcomes of patient care, electronic health records, team-based care, working together as a team.
That's a big thing too, because I know we had a CEO of a hospital on one day saying they're trying to correct the situation where nurses are doing so much paperwork they can't spend any time with patients, and they want to try to flip-flop that.
Sure, and we want to be able to share information readily so that one doesn't have to ask the same questions to the patient over and over again. It's there in the medical record.
Oh, yeah.
And we can all access it and use it, and it really improves safety and outcomes.
Yeah, and it's easier on the patients too. I mean, that's stressful if you have to keep going over the same stuff, information. How have your graduates at UNCG School of Nursing fared in the actual job market?
Well, nursing is very robust, and the health systems are strong, and our graduates usually have jobs by the time they graduate, 85–90%, and within 6 months to a year, they all have jobs.
Wow. Wow. Now, this is sort of going to sound like a redundant question, but what kinds of opportunities exist for someone with an education in nursing? What kind of things can they do?
Oh, there's a tremendous career path opportunity for nurses. Certainly, there are the traditional roles in the acute care setting at the bedside, working with folks that are in the hospital, but there's certainly an increase in growth in community-based care, in office practices and clinics and nursing homes and long-term care settings.
Sure.
And then
hospice.
Hospice. And then there's advanced practice. So one can go on for advanced practice nursing and become a nurse practitioner or a certified nurse anesthetist, and even beyond. There are positions for research and practice.
What a wondrous time we live in, and what a great program to get these folks prepared. Give me an update on Union Square. A lot of folks who may not know about this, Union Square campus. So what's the status of that project?
Well, it's very exciting. When we were here a year ago, it was really just a picture that we all had in our minds that we could accomplish. But since then, we've planned the building, we have the specifications, we have funding, we have the leases signed for all of the partners. This is a collaboration between NCA&T, GTCC, Cone Health, and UNCG. We are planning a groundbreaking event on April 7th, and so we're ready to roll with putting the building up and occupancy in August of 2016.
Help me understand, because I want you to enlighten me about this. Is the whole School of Nursing moving there, or just certain programs moving there, or what's going to be offered there?
Right, that's a good question. No, because it's a collaborative process, we will share the space with our partners. And for UNCG, we will be taking our DNP, our Doctorate in Nursing Practice program, our new program, down to the downtown campus. I'm very excited, and that's our nurse practitioner program and our certified nurse anesthetist program. We'll also have some of our RN to BSN courses down there as well. Any
other initiatives or things going on we should know about?
Well, we're certainly expanding our RN to BSN program, and so you probably will hear about cohorts at Davidson County Community College and Alamance Community College and lots of places to come. And we also have a new Veterans Access program. We have funding from the federal government to do an accelerated program for veterans that have medical training and experience in the military.
I didn't think about that. They're coming out of the military and they've been medics or whatever, and now they can maybe they want to be a nurse or nurse practitioner. Isn't that fascinating? That's just great. Absolutely. You do such good work over there. I'm so proud of you.
Wow.
It's just great. uncg.edu is the website up there that you can get all sorts of information about the university and what's going on, and also take you to the School of Nursing. And if you're thinking about a career in that, I'm sure you can give Robin and her folks a call. Maybe you're a junior in high school and you're thinking about, gosh, I'd like to be a nurse. They can come over and tour and meet with you and everything, right?
Absolutely. We'd love to host folks to come in and see our new simulation space and all the good stuff that we're doing there.
You're great. Thanks for all you do.
Thank you.
We will be right back after this.